What's up, everyone? Drew here, and I am here in Draper, Utah at a place called Bio Restoration, and today is August 26, 2020, which means tomorrow, August 27th, is the first day of my Fit2Fat2Forty Journey, which is a little bit scary, I'm a little bit nervous, I'm not going to lie, because it's actually feeling real now. And so tomorrow I start the journey. And so why am I here in Draper, Utah with Dr. Amy Killen? We are bringing her on to talk about sexual health. And I'm going to let her introduce herself really quick as to why we're bringing her on. But I think it's really important to bring in someone like her to this journey because I want to track as much data as possible, but I also want to educate people out there as well because sexual health is something that's overlooked. It's taboo for some people, but I really want to bring that into this journey this time around because last time around I didn't have access to a doctor like you because I feel like now that I'm turning 40 this year, things change and we're going to talk about that. That's why I have Julie here too because she has some questions for Dr. Amy.
And I don't want things to change.
So we're going to talk about all of that in today's episode. So first of all, Dr. Amy, thank you for being here. How are you doing?
I'm great. How are you guys?
We're doing fantastic. Yes. So why don't you introduce yourself a little bit to my audience and then tell us what you have in your hand.
Okay, so I'm Dr. Amy Killen. I'm a anti-aging and regenerative physician here outside of Salt Lake City, Utah. And I do a lot of work with sexual health. That's kind of one of my main focuses is sexual health and using sort of preventative strategies combined with other things that we can do to treat sexual problems. So Drew is a friend of mine and we wanted to talk about, what this journey might look like for you and how your sexual function and health may change.
Yes, which I think, like I said, is really important to showcase that. So what we did to get started is we did some baseline blood work that Dr. Amy's going to go over today. We're going to talk about what those numbers look like, what they mean, and then we're going to track that progress throughout the journey so that you guys can kind of see, okay, over the course of the next 4 months as I gain weight, how are those numbers going to change? How is it going to affect my sexual health? And then obviously Julie's gonna have some questions for Dr. Amy, and me as well too. Honestly, I really will, and I think this is really important. So we're gonna have fun with it, but it's also gonna be educational. So why don't we get started with what the numbers say and what your opinions are?
Okay, so you've had a lot of blood work done recently, I know, and I won't go over everything, but some of the main things we look at are testosterone levels, so total testosterone as well as free testosterone.
Yeah, can you explain the difference between those?
Yes, free is sort of the unbound, free to act within your body testosterone. So it's really very important to know what your free is.
Okay.
Total testosterone includes testosterone that's also bound to protein. So if it's bound to protein, the protein kind of makes it inactive. So the free is like all the rest of it, the stuff that's like floating around and it's actually working in your body. So we have both of those numbers for you. And then we had some other things. So with testosterone, your total testosterone was just about 500. And normal range for this lab is 250 to 836 based on your age.
Yeah.
Now, if you were 10 years younger,
a huge range.
It's a pretty big range.
Yeah.
And that range is adjusted for age. So as you get older, that range goes down, the lower numbers become more common.
Yeah.
But so you're kind of right in the middle at 500. Now, your free testosterone, you are actually a little bit low.
Okay.
So normal range is between 57.3 and 240, and you're at 57.2.
Oh, right under the cusp.
So you are 0.1 low. And that's the testosterone without taking testosterone, correct?
Yeah.
Okay.
Yeah.
And as you know, a lot of guys, as they hit 40, 45, 50, start to have this diminishing testosterone and sometimes need replacement or other medications or things like that. Not everyone, though.
Yeah, and that's kind of natural how our bodies work, right? So my question is for all the 40-year-olds out there, do we just let nature do its thing or do we try and combat that by keeping high testosterone levels? So is that an anti-aging thing? Is that a
there's a lot
sexual health thing?
I mean, the short answer is you don't want really low testosterone.
Yeah.
Low testosterone is associated with increased diabetes risk, obesity risk, heart disease risk, increased risk of overall mortality.
Gotcha.
So we don't want it to be very, very low.
Yeah.
Now, whether or not you need to be at the higher end or not is, I think, up for debate.
Yeah.
But you definitely don't want to be super low.
Yeah.
The good news is there's actually a lot that you can do to kind of bump up your testosterone. So things that you're already doing currently, like exercising regularly, lifting weights as well as cardio, eating healthy, not having a lot of abdominal obesity, not sitting around too much, getting enough protein, getting enough sunlight, like all of these things are keeping your levels high.
Yeah.
So they're gonna drop a ton because you do all of that like perfectly to a T.
Yeah.
Exercise, eat well, sunlight. So I'm really worried how much it would drop.
I think, so give you guys some reference. Even when I was 31, I didn't get a baseline test of my testosterone before I started, which I wish I would have done. But I do know at my heaviest, it did drop to just above 200. Like 200 at 31 years old.
That's low. That's actually really low.
Yeah, when I gained 75 pounds in 6 months, it was the low 200s. And then the other time and this is all that I can remember from almost 10 years ago, was 30 days later, changing my nutrition, exercising again, it bumped up to 400 or so in 1 month of eating healthy and starting to exercise. I don't know what it got up to though. So I think it's interesting this time around. I do all those things that you guys are talking about. And starting tomorrow, I will stop doing those things for 4 months. So I guess what we can expect is those numbers to drop significantly.
I think so.
Okay.
The good news is, at least last time, you bounced back pretty quickly.
Yes.
And that I think is really a good point for people who have low testosterone. Maybe they're a little overweight. Maybe they're not, making the best lifestyle choices. There's actually a lot that you can do to bring that number up without having to take medication.
Okay.
But in someone who is, going on this journey, if you will, where you're going to be kind of reversing all the good lifestyle choices that you've been making, I think that we're going to see a sort of a plummeting of testosterone. And that's going to mean a lot of things. So, like, first of all, lack of motivation is a huge one. And that's one of the first things.
Oh, no! Like to do anything?
See, this
like to clean the house. So, lack of motivation.
Lack of motivation or loss of that motivation is one of the first things that people complain about with me when they have low testosterone. It's feeling kind of blah, like feeling like just feeling not maybe depressed, but maybe just kind of not feeling great. Yeah. And then it's this lack of like any motivation to do anything. So that's one thing, and I think that is something for you to know.
It's not my fault.
Excuse. Now
it's not my fault. I can't help out with the dishes, or it's low testosterone.
But it's going to make it harder. With that in mind, think about when you restart your fitness journey and you actually are trying to go to the gym and you are trying to to get on the treadmill or whatever. Yeah. Like you won't have the motivation that you do now.
Interesting. Yeah.
It will make it harder for you to get started again.
Which I think is really important for everyone listening. Like when we do this journey together in January, when I started this journey, it's not just going to be me doing it. It's going to be, thousands of people across the world doing this. Like it's important to remember that like in the beginning, it's going to be harder than it normally would be. Mm-hmm. But just trust the process that eventually things will balance out. Your body's pretty resilient, I think. And those numbers hopefully will go back up to the point where you're like, all right, now I have higher testosterone. Now I have more motivation to go to the gym, do the dishes, have more sex, right? That's probably another thing too, the motivation to have sex too.
Yeah, so your libido, your sex drive will probably also plummet. I mean, I can't say plummet, but it probably will. Yeah. If your testosterone goes down as much as, given last time it went to 200 and that was 10 years ago, 9 years ago. So that's like 200 is legitimately low testosterone. Yeah.
How low could it get from 52 then?
I mean,
the free testosterone.
That's the free.
The free. Okay.
It could go. The total. I wouldn't be surprised if you are down in the 150 to 200 range again. Yeah. And
what would the free probably go down to? Like 10s? Because what are girls at? What are girls at?
Women are at like 10 to 30 or 40.
Yeah. So just above a woman
for free. Depends on the person, but so like sex drive, libido from the testosterone standpoint will likely go down. You also could have problems having erections.
Mm-hmm. That's what I was going to ask about blood flow. Like what would there's no measurement really to show what my blood flow is right now, right? Or
well, I mean, you could do a Doppler or something, but you don't, as long you don't need to. Yeah. But because of low testosterone, which is one component of having normal sexual responses, normal erections, is testosterone. So if that's low, that's a problem. But even if it's not low, you won't have as much nitric oxide as you do now, because nitric oxide it's the main chemical messenger that tells your blood vessels to open up and that blood can get into your penis. And so as you get older, for all of us, your levels go down. And so it's just every year we get older, we make less and less nitric oxide.
Okay.
However, when you're healthy, when you're exercising regularly, when you're outside in the sun, when you're doing, all of these things, eating lots of healthy food, then you're able to create more nitric oxide in your body. So all of a sudden, you're going to have lower testosterone, you're going to have lower nitric oxide, and then you probably also will have some psychological components, sort of body issues potentially to think about as well. Which is a big part of sex also. Like how you feel about yourself really plays into whether or not you want to, to get it on.
Are you having second thoughts? Or?
No.
It's like, I'll see you in 4 months.
Maybe now that you're aware of these things, you just remember them in the future that, it's because my testosterone is low,
Well, that's what I'm saying. Is like, it's important for couples out there that are watching too, to like the women to be understanding of like, all right, if her husband's getting older and his testosterone is low, he's not being a mean person or like he doesn't care anymore. It's just it could be hormones.
Women, we think it's us, so this is actually great for the women.
That's true.
Too.
This is important for you because
always, what's wrong with me? What needs to be different? So it's good to know that it's
blaming on the hormones.
I think that's a really valid point. I have a lot of women who come in, their husbands have erectile dysfunction, and they completely blame themselves. Right. I'm not pretty enough, I'm not young enough, I'm not thin enough, I'm not sexy enough, and obviously it's not their fault. And it's something that I think it's even if you know that in your brain, it's still there, and it's still hard to navigate. So that is something I think that's a really good point.
Okay. That's important for all the women watching. Obviously, we didn't do any like super rare test to get a baseline. Like, what other tests should people look for other than testosterone to know if their sexual health is going to be affected? Are there any other tests that people can do other than testosterone, or?
I think that for most people, just getting a basic sort of lab panel of regular tests is really important, just as a baseline, even if you're not unhealthy, but just to see kind of what your numbers are. But, other things you can check, things like inflammatory markers, which I'm sure that you had like CRP and things like that checked, I suspect, with your
is that not in here?
Other doctor.
I think we did, and with the other doctor, very low inflammation right now.
Yeah, yours super low. So CRP was less than 0.2, which is as low as it goes. So that's something else, that's a marker of just general inflammation in your body. And as you are making poor food choices and as you are, having not exercising and all those things, I suspect that number is going to go up. Maybe not to a big degree. It depends on kind of how your body reacts to the foods that you're eating. But that inflammation over time, and maybe not over just a few months, but over years, can absolutely lead to erectile dysfunction that is difficult to turn back. It's not impossible, but that's something that will actually change the way the cells in the penis behave, and it can create cells that are not as elastic anymore, are not as healthy. Those cells can get replaced by fat or by like fibrous tissue. And all of a sudden you're not able to have and to maintain erections for as long as that. And a lot of that's inflammation, which is why things like diet and exercise and sleep and stress are such a big deal. Like, they absolutely affect how your sexual organs, both of you, are going to behave long term.
So eat well, because it'll affect your penis.
Eat well.
There you go. All the men out there. All the women, tell your husbands. Like, hey.
I have a question.
Yes.
Okay.
Is it true that as a man's body gets bigger, his penis shrinks? Is that true?
There's a yes and a no. The yes is that the part that you see can become smaller.
And the part that you feel. Right?
The part that you feel, the part that you see. Because the actual penis is not shrinking, but more of it will be inside the body than currently is.
So it appears to be smaller.
It just tucks away.
It tucks away. So when you have when you have a kind of fat, if you have a penis and it's this big, and then part of it's down inside the body, you don't see it. The part that's down here, right? There's like a whole section down here. But if you gain weight and the weight goes out this far, then all of a sudden your penis is this big. It hasn't shrunk. It's still there.
So it really
it's the same size, but it just covered up a little bit. Part of it's covered up.
It's not just like there's a belly here, so you can't see it. It's that you're actually...
I mean, usually you have you have weight in the sort of, suprapubic area that's going to cover up some of the penis. Now, I will say over time, if you develop erectile dysfunction because of low testosterone, because of, low nitric oxide, because of inflammatory, issues, over a long period of time, you can have shrinking of the penis because it's kind of like muscles. Like it's like use it or lose it kind of thing. And so you can have shrinking of the penis over time, but that's usually over years.
Yeah, not 4 months, hopefully. Knock on some wood.
Okay, I have another question.
These are good questions.
Okay, this is a little different. And I don't know if you test for this specifically, but I really wanted him to get a sperm count test before, during, and after. And I'm wondering if weight gain affects sperm count. Because again, I have... know so many women who have fertility issues and they're always blaming themselves. But oftentimes we don't necessarily look at our partner and say, well, maybe he should get checked. So is that something that would be effective? Yeah,
we didn't check sperm count, but it can certainly be. And a lot of that's hormonal. So you're not, we don't do sperm here. No. But that, your testosterone plays into the feedback loop, and the other hormones that create testosterone, luteinizing hormone, FSH, some of these things are really important for making sperm. And certainly you can kind of decrease the production of those through some of the same lifestyle choices that we've talked about. It should be reversible, but it's one of those things. It's a good question, I think, to have, because absolutely, we know that as a society, that sperm counts have gone down significantly in the last 50 years. That infertility has become more of a problem. Probably environmental toxins, food toxins. We're sedentary. We never lift heavy stuff. We don't go out. We're not as active. We don't sleep as much. We're stressed. Like all of those things affect your sperm count and your ability not just to make sperm, but to make viable sperm. So lifestyle it's kind of key.
Yeah.
This is really interesting. I'm so glad I came for this.
So one of the questions that I have, and this is something that I wanted to talk to you about, because you're one of the few people I know that knows a lot about this stuff. But basically, during this journey, obviously it would be ideal to take a testosterone, replacement, because it's going to plummet. But I want to make sure the journey is educational to show people. So
realistic.
So we're just going to have to deal with low testosterone. And then on the journey back to fit, obviously I want to see what diet and exercise can do, vitamin D, sleep, all that can do to get it back up, see where we can get it back up. And then from there we can discuss, okay, do I still have low testosterone? Maybe it's a genetic thing, or maybe it's just an age thing. We can look into that. But the one thing that I want to talk to you about is peptides, which is something that's very new. Not a lot of people know about, but I'm curious to know, for example, if there are peptides for specific things like sexual desire, right? But it doesn't affect testosterone.
Right.
It wouldn't affect my blood work, really. It's not gonna.
Right.
So is that something that people out there could look into as an option, instead of going hey, I don't want to do TRT just yet? Is peptides an option for people
It is they are an option, but I think they're also a little bit difficult to come by.
Okay.
Only certain specific doctors, a pretty small group of doctors, are familiar with how to do different kinds of peptides.
Can we back up? What are peptides?
Oh yeah,
yes.
sorry.
Good question. Yes. So peptide just means a very short protein.
Okay.
And what they are is that there are a couple of compounding pharmacies that make these peptides that essentially are like the action arm of the protein. So they've kind of figured out these little short proteins that can still fit in the receptor of whatever the receptor is, and then they can do the action that they're looking for. So the one you're talking about, there's one called PT141, which is actually just now got FDA approved as a female drug for sexual dysfunction, but it's been used for both men and women for many years.
Yeah.
It's an injectable, you inject it, under your skin, and then for the next 5 or 6 hours, it kind of turns on a switch in your head. We don't really know how it works, honestly, but it basically makes you more interested in having sex. And so that's something that is not dependent on testosterone. It's a whole different pathway. honestly, though, I wouldn't jump right to that.
Sure.
It's something that you could use it if you're doing everything else right, and you
Gotcha,
wanted a little bonus.
Yeah.
But, it's like there's no magic pill. You really have to do the work to get yourself in a good place foundationally. And then you can add in some of the fancy stuff, to help recover function later on.
Cool. Well, we're going to have to buckle down for the next 4 months.
Apparently.
So, yes, and a lot of sympathy towards Julie.
Well, we do have like Gains Wave, for instance, that we could definitely do on you, like as you're trying to kind of pull out of this. Gains Wave is like it's acoustic wave therapy for the penis, so it uses high intensity sound waves and essentially increases blood flow to the area, increases stem cell recruitment. So you get better blood vessel formation, and it's very reparative. So that's one of the things that, especially if there's, some lingering effects of this journey later on, that we can do a series of Gains Wave treatments. Awesome. And I think that will really take you back in time,
and this is why I want to have Dr. Amy on, to be able to talk about this stuff, because, if I do decide to do that, I will let you guys know. And I've done it in the past, and I've loved it. Like, I haven't had issues in the past, but I know for me it's more of a preventative thing. So I want to make sure that that's like, something that people are aware of and can have as an option. And so that's why I wanted to bring you on. So like, if I do decide to do that, you guys, I will let you know. And I think that would be a great option for people to have out there. And I'll just be totally honest with you guys about my feedback and how it works. And it's an interesting thing. It's like a jackhammer on your penis.
Yep.
And it's not the Gains Wave. It's they put numbing cream on, at least, so it's not too painful or too uncomfortable. But it's like 20 minutes, right? Mm-hmm. And it breaks up the plaque or something in the blood vessels, and it allows for more blood flow. So it's been around for a while. I know a lot of people use it in the industry. So
it's great. Even if you don't have problems, it's a great treatment.
We probably won't record that, though. Sorry, you guys.
It's super loud. Yeah.
You mentioned sunlight earlier.
Uh-huh.
I don't know what the official term is, like sunning your bum hole. Is that a thing? Are there really benefits?
It's a thing. I don't know that there are any proven benefits.
No, there's no proven benefits.
So anyone who's...
They're just trying to show off their backside.
But I have heard sunlight on the testicles is boosts testosterone.
Potentially. There's not a lot of evidence. But I will say testosterone, sunlight in general, it can be helpful for making testosterone, because you're getting increased vitamin D. You're also getting nitric oxide, which again is getting the blood flow, all over the body. So sunlight in the right amounts, you don't want to ever cause burning, but a little sun is definitely something that I think is good.
So a quick question about vitamin D levels, because my vitamin D levels at this time, you guys, I think I did blood work. What was the date? Does it say what date I actually drew blood?
Yes, 7/20.
So so almost a month ago, or just about a month ago, I took this. My vitamin D levels were too high.
Were you taking vitamin D also?
I was taking vitamin D and being out in the sun.
And being outside. Yeah.
And so what would be the unhealthy benefits of too high vitamin D?
Well, you could definitely go too high, and there could be some side effects. And unfortunately, this lab just says above high. Oh, it doesn't even tell us how high. Like you could be, the normal range is maybe 30 to 100, depending on the lab, and you were over 100. So definitely I would, if you're in the middle of summer and someone like yourself, you probably don't need to take extra vitamin D if you're outside in the sun.
Yeah, I just redid it a couple weeks ago, and it was 67. So I backed off on the vitamin D supplementation. I was taking about 5,000 and 10,000 per day.
So I like levels to be kind of in the 50 to 80 range for vitamin
67, D. So I tapered off, and it feels like that's kind of where.
Yeah.
But I was just wondering if that could cause low testosterone too, if my vitamin D is too high.
Not that I know of, but I haven't looked into that. Okay. I know if it's too low, it definitely can.
Yeah. Okay. Any other questions about that?
Last question.
Okay. How else can you embarrass me? Just kidding.
So we know you're not going to be eating well.
Yes.
Or drinking well and not well,
I'll be drinking alcohol this time around.
Soda and whatnot, and you're not going to be exercising.
Yeah.
So what things can he be doing for my benefit, to keep the testosterone up, like sleep. I'm gathering that you need to sleep a lot.
Yep.
I can still get outside.
Yep.
Okay. Any other things?
Making sure you're getting enough branched chain amino acids.
Okay.
So you can,
protein.
Protein, or if and or other supplementation of branched chain amino acids.
What about nitric oxide supplementation?
You can definitely, absolutely. You could take a nitric oxide supplement.
Okay.
Like Neo 40 is a good one, or several other ones out there, but that's something that is great. All the things I'm thinking are things you're not going to do specifically.
Yeah, I know. Yeah.
Stress, trying to keep your stress
under
control.
I do plan on meditating and journaling
that's a big
every day. So that's what I'm saying. Like this time around, I have more tools in my tool belt versus back in 2011, where I just kind of I didn't really know what I was doing. But now that I do, I have these tools I think that can help some of it. But ultimately, we all know what's going to happen. Testosterone's going to go, my libido is going to go down.
Hey, let's not ourselves. It could, but it might not. It might not. Stay positive. I'm staying positive.
Okay. She's like optimistic.
Yes.
I already know it's going to.
Well.
And I'm older this time. I turned 40 in December, so we'll see. We'll see how it affects me this time around. And how quickly it bounces back. Last time, I feel like I bounced back pretty quickly. But this time around, we'll see.
We shall.
Yes. Well, thank you, Dr. Amy.
Thank you.
Yeah, so we'll be drawing more blood soon, you guys, throughout the journey, and we'll meet with Dr. Amy, and she can kind of become your therapist in a way. So what can I do?
She starts texting me at midnight.
She's like, help.
I need those. What is it called?
Gainswave? No, nitric oxide.
Nitric oxide. I need some emergency.
But no, I think it's going to be really interesting. Like I said, I want to make this journey more educational than the first time around, and so thank you for being one of our experts. That's going to help us throughout this journey and document all of that and show the progress, the backwards progress, and the forwards progress coming soon. So stay tuned, you guys. And Dr. Amy, once again, thank you very much.
You're welcome.
See you guys.